if your child or teen knows someone who died by suicide, how should you approach that with them? What should you say to them? How should you help them work through that grief?
Yeah, that's a really important question, and it's tricky. Because I think as parents, we often don't know how to talk about it. But the challenge is we do know how to talk to our kids, so how do we apply those same things around a topic that is sensitive, that's difficult to discuss, that might ultimately lead to our child saying, I've been having some of these thoughts too, which I don't want to hear about that, just because it makes me feel awful and I don't know what to do about it. But I think you have to sit down with your kids and say, I'm sorry, I'm really sorry for the loss that you've had. How are you feeling? What's going on? Oh, I'm fine, no big deal. It's okay. It's normal and natural for kids to have a lot of different feelings when it comes to losing a friend of theirs, regardless of the cause of death, but certainly around suicide, because again, sort of that whole idea of, did they intentionally do this? Was it a choice that they made? Did it have any relationship to them? Were they at fault? Kids have lots of thoughts in their head about what all this stuff means and what does it mean to them, and it's important to just say, how are you? It's okay to not be okay. I want to make sure that I can help. How can I help? What do you need from me? And if they're very closed and they don't want to talk about it, sometimes the best thing you can do is say, listen, it's okay. I understand that you don't want to talk about it now. You know how to get in touch with me. I'm down the hall. You can text me. I'm downstairs. But the point, be open, be available. And I would go back and check in with them again a little bit later and stuff like that. Because this is a difficult thing for kids to handle. And again, it's hard for parents, but the more that we can kind of say, how can we be supportive and help them, I think the better off we are.